Thank you very much. The discussion today is on the road to recovery, the Indian economy post-lockdown. So we are now looking at some lifting of the lockdown on the 20th of April, a partial lifting of the lockdown, and then a full lifting as things stand today on the 3rd of May. Now, this is an unusual time for many reasons. It's perhaps one of those rare occasions where we are combining different disciplines. And in this case, the discipline that's perhaps a little unusual to an Ananta Aspen Center one is that of medicine, because medicine and health will play a critical role and will drive every decision we take in this road to recovery and what we will need to do. So these are unusual times, and even the word new normal is a cliche, but it's a very, very relevant and valid cliche. So our three speakers are going to speak for about 5 minutes each on how they see the backdrop of the lockdown, on how things have changed so far, what has been the damage caused to the economy and to our health, and finally, what should we be doing in order to work on the recovery process to repair all the stress and the damage that's been caused to the system, both on the health side as well as on the economy side. So this is really what we're trying to focus on. Your questions and comments are, of course, more than welcome, and will contribute to the richness of this discussion as we go along. So we are going to be speaking till, we're going to be on till 12:30 p.m. So if you have questions and comments, please do get them in much earlier. So without further ado, let me invite Dr. Naushad Forbes, co-chairman of Forbes Marshall, and a former visiting professor at Stanford and past president of the Confederation of Indian Industry, to kick off proceedings.
Thank you, Govind. And it's very nice to connect with everyone in this virtual way. You know, when I speak, I really like eye contact with the audience. Unfortunately, that's not possible with this virtual connect. So I can't really tell, you know, if people are, if their eyes are glassing over, or if they're, you know, helping themselves to a snack while we chat, or if they're concentrating on what we say. But let's go on the basis that everyone's out there really hanging on to every word that you hear in this next hour. You know, it's clearly the situation that we find ourselves in is unprecedented. That's the word that every commentator uses. It's unprecedented in terms of the global reach of the virus. It's unprecedented in terms of its impact. It's unprecedented in terms of the response, the lockdown of the economy. I saw a report that said that 90% of all factories have actually stopped production in the lockdown. It's unprecedented in its disruptiveness for lives of people on a day-to-day basis. And we see the results of that in our cities with hundreds of thousands of migrant workers who are stuck trying to get back home without their daily wages on which they live day to day. So how do we see things going forward? What's the best way of bringing the economy back on track as quickly as we can, and doing so in a manner that is fully safe? I'll leave the medical issues to Erwin to address. He's much more qualified than I am to address them. But let me make a couple of comments about the economic recovery. To me, the most important thing that we can do is to sustain earning power of people and to sustain employment. Because if we can sustain earning power and employment, then we have the foundation for a significant and quick recovery. How do we do that? Two proposals that we've been promoting from CII as well with the government. First, to use the Jan Dhan accounts as a way of targeting direct benefit transfers in a widespread way to people in the informal sector of the economy. So, you know, people who are rickshaw drivers or delivery boys or shop assistants or tea sellers. They otherwise have no livelihood left, and we need to ensure from both a humane perspective and from the viability and success of our cities and the lifestyles that we've got used to, we need to ensure that they are supported. And I'm not talking about a stimulus package, I'm talking about a support package here. The second thing is support for companies. And support for companies, again, it seems to me, should take the form of employment support. And what we've requested is loans from the banking system to all enterprises, whether it's a small shop or a large company, doesn't matter, to all enterprises, covering 3 months' salaries at a 4 to 5% interest rate, which is the same rate at which banks can borrow from the Reserve Bank of India. And if these loans are guaranteed by the government, then we have, it seems to us, a way in which a very limited outlay, just the guarantee from the government, can go very far in terms of ensuring very widespread employment support. If we can ensure these two things on employment, and then one more thing, and then I'll stop, is logistics. You know, one of the greatest problems that we faced as a country in the lockdown has been that the entire logistics sector has kind of ground to a halt. Even though there have been very explicit notifications from the union government that all goods, essential and non-essential, can move around the country freely, it's not happening because the implementation at the ground level is very variable. Second, truck drivers are very concerned about moving around the country because dhabas need to be open so that they can eat when they drive across the country. Repair shops need to be open, petrol pumps need to be open. Otherwise, how do they operate in an effective way? And they need to feel secure and safe for themselves and their families as well. So we really think that if we can get logistics addressed as a very specific thing, it will help the economy very broadly. I'll stop there.
Mr. Forbes, now let me invite Dr. Erwin Kumar, chest surgeon, chairman of the Center for Chest Surgery and director of the Institute of Robotic Surgery at Sir Gangaram Hospital and also founder of the Lung Care Foundation. Dr. Kumar, it's over to you.
Thank you, Mr. Govind, and good afternoon, or rather good morning to everybody. Am I audible, Govind?
Yes, you are.
Okay. Thank you very much, Dr. Naushad, for that very lucid introduction and laying the foundation for carrying on with the three main areas about how do we move further from here. But before just 1 minute each, I would spend, because many people still have this view that this lockdown was probably too strong a measure for the kind of problem that the country was faced with. I would just like to tell, this virus spreads like a wildfire, and we have seen this happen in US and Europe, that a huge number of people get infected suddenly, and then 15% of them start needing hospital admissions. So the hospitals suddenly get inundated with these cases. Hospitals are not ready to face that. The healthcare workers are not ready to face this kind of population coming in. The healthcare workers start getting infected. The hospitals start crashing, and you have a mortality which is much higher than it would have been if the same load of patients had presented to the same medical system, but in a distributed manner with a better preparedness. Now, this is exactly what these 15 days or 3 weeks of first lockdown has given. I'm aware of the health infrastructure of the country. Let me share with you that on 20th of March, when we talked about the lockdown the first time, a majority of the medical fraternity in the country was not even aware of how you are going to treat these patients if they land up in the ICUs. The protocols were not there. The protective equipments were not there. The ways to separate a COVID patient from non-COVID patient was not there. And if we had been inundated with these patients between 20th and 30th of March, then the whole system would have crashed. And let me also share that in the last 2 weeks or 3 weeks, it's been a golden period in which the entire medical community has worked about 12 to 14 hours a day. Number one, in updating their knowledge. So the entire medical associations have been conducting webinars with the people from Europe and US, learning from their experience, learning from their practices. And today, we are million times better knowledgeable, better prepared, and better equipped to handle the load that is coming. And second thing is, it has spread out. I'm not saying that the infection has been brought under control, but the numbers are still manageable. The hospital beds are ready, doctors are ready, ICUs are ready, and that is why our mortality is much lower today. And I expect it will remain lower than what Europe or USA is seeing. So that's a huge, huge, huge benefit which has come from the lockdown. But lockdown is a very major emergency surgery. Whenever we do an emergency surgery, often we chop off a limb or something, but that's always in the absence of a better alternative. So if we had not done this surgery, the alternative would have been a mayhem across the country. Healthcare workers would have paid a huge price. Till now, even with this limited number, 4 doctors have died across the country, and there are nearly 40 people who are still positive. Many of them are still on ventilators. There are a lot of nurses, technicians, healthcare staff who are still in ICUs, etc. And this number would have been many times. So with that background, lockdown was necessary. But now, how do we move further? For me as a doctor, the time to lift lockdown would be 3 conditions have to be met. Number one, the cases have to be on the decline. The lockdown cannot be lifted nationwide, maybe pockets, yes, but nationwide when the cases are still on the rise, as is the case presently. But I guess in the next 10 to 15 days, we should be having a decline in the number of cases. Number two, even when you lift the lockdowns, there will be certain hotspots which will continue, and we will need to have very, very strong testing and containment strategies for those areas so that the infections from there does not spread to the other area. And thirdly, the improvement in the hospital infrastructure on which we have concentrated so heavily, it needs to continue so that in case, by chance, there is a sudden surge in the number of cases, the hospital should be ready to prepare for that. So that's about the health preparedness angle while taking a decision to lift the background. Just one more thing I want to bring into picture. When we talk of recovery from a calamity like this, there are 2 situations. One is a calamity like a massive earthquake, a flood, a tsunami, something which causes huge destruction to the infrastructure and also loss of lives. That's one situation. And second is this situation where there is no destruction to the infrastructure. 130 crore people are still alive. The loss of lives have been fewer. Only thing that has happened is the whole thing has been in a long weekend mode. So when we go back to reviving economy, our factories are still intact, our highways, roads, everything is intact, the manpower is still there. All you need to do, as Dr. Naushad very elegantly said, little bit of oiling here and there, and the wheels of industry will again start moving. Another huge factor which India has positive is 65% of our population is under 35. And with the collective strength of these people, I have no doubt in my mind that 6 months from now, if there is one economy which will be booming, it will be India, and we will be far, far ahead of Europe, US, or China. Thank you, Govind.
Okay, that's
sorry, I included a little bit on the economic, which is not my area, but that was just what, you know.
And the dose of optimism. Okay. A.K. Bhattacharya, editorial director of the Business Standard, formerly editor of Business Standard, columnist of the well-known columns New Delhi Diary and Raisina Hill. AKB, over to you.
Yeah. Okay. Thanks. Thanks, Govind. Glad to be here. I will restrict my my comments to 3 issues that you have raised. One is my takeaways. 2 would be what are the lessons, and 3 is what about the future. So let me begin. I believe that the imposition of the lockdown was part of a graded response of the government, the COVID-19 outbreak. Make no mistake that the lockdown came after similar unprecedented steps like the closing down of the country's international borders by keeping in abeyance all tourist visas, including those issued to the non-resident Indians, stopping of international flights entering the country, and then we saw the national lockdown. So these are very, very unprecedented steps. Now this graded response, mind you, was also a recognition of the government's own woefully inadequate capacity in health infrastructure. And I would, say that the government recognized that on the health side, we were unprepared. And therefore, the government's assessment was that if the disease was allowed to spread, that the country's capacity in terms of beds, ICU facility, and ventilators would just not be enough to meet the challenges. Thus, the extreme step was the lockdown was taken to flatten the disease growth curve. And it did have a huge impact on the economy. I think the rate of doubling of the diseases, as Dr. Kumar pointed out, has actually seen some sort of a deceleration. But on the economy, this impact has been huge. It was a kind of an unfortunate trade-off the government chose between, in my view, lives and livelihood. And we all know how in the coming days the growth will be impacted and how the informal economy will be hugely hit. Most significantly, the working class of the informal economy, accounting for 90% of the workforce, will be hit not just by job losses and economic distress, but I think more worrying thing is that they will be exposed to serious health risks associated with lack of basic food and nutrition in the wake of an epidemic. So the problem is not just of lower economic growth, but also of an impoverished and weakened working class, which in turn would again affect the economy in various other ways. Now that's my takeaway. Now, what are the lessons? I would say in brief, 3 lessons. The overall response, I think, suffered from the weaknesses of sequential planning. I think there was no concurrent planning. If you wanted to impose a national lockdown, which I think senior people in the government were aware of, when the Janata curfew was announced, because the Prime Minister did talk about that, please be in readiness for a similar kind of situation. I think we should have ensured that the millions of migrant workers, poor people, the man who was a street side tea stall or a hawker got something by way of an economic package for all such people. And this should have been readied and launched almost concurrently on the same day as the lockdown was enforced. But there was a delay of almost about a week. The second lesson I would draw from our experience is that we should stop and end the neglect of our healthcare sector that we have allowed for the last so many decades, I would say. The tiny portion of our total expenditure is allocated to the health sector. And it's because of this neglect, in my view, for the last so many decades, that we have been worried and wary of experimenting with, and this is not my area, maybe Dr. Kumar can spend a lot more time on this, experimenting with herd immunity. And we are naturally worried more about people falling sick and even our failure to conduct adequate number of tests, which is so vital for creating data on COVID and using it for further treatment. And the third lesson for me is a very positive lesson, is that the way most Indians, particularly those belonging to the lower end of the economic spectrum, have behaved with so much tolerance, so much fortitude, and so much discipline. Now, this is a lesson, I think, for the whole country. And I think they did not have a choice, maybe, but I found that new quality in the Indian people's behavior in this crisis quite an attribute and a lesson. Finally, what about the future? Well, the new normal would mean a significant shift in the way we do business. And I don't think that we will go back to the old ways of doing business. And also the way we behave socially will undergo a dramatic change. Business models will undergo changes. Work from home would be a new instrument and even an opportunity, in my view. Digital technology, as we ourselves are seeing in this webinar, will play a bigger role. Would it mean a shift towards greater localization? I'm not too sure, but I think localization of manufacturing instead of the earlier idea of globalization probably would be something that people will experiment with. And these are questions that we will have to wrestle with in the coming days. I think I've said a lot. I think we should end here. Thank you.
Okay. Thank you, AKB. So lots of interesting and useful points and questions that have become coming in as well. So let me address some of the health ones, because that's, as we all agree, a prelude to getting many things off the ground. Dr. Kumar, so one point that Ashok Bhattacharya made was that we are really staring at a workforce, particularly migrant labor, informal workforce, that is and will be weakened and impoverished. To use his words, and that is true. And many of them are not even there where we need them. So focusing on their health, or ensuring that this disease, which is not going to be going away in 15 days time, does not come back and affect them more than anyone else, is going to be a key challenge. How do we do it?
Well, good question, Govind. First of all, I'm quite enriched with the comments from both Naushad and Ashok ji. Thank you very much to both of them. This segment is a very, very important as well as vulnerable segment. And their vulnerability comes from, number one, their being severely malnourished. Number two, having many diseases which cannot be addressed because of their inaccessibility to healthcare. And number three, they're living in very impoverished kind of houses or localities where they are exposed to much higher vagaries of nature and exposed to diseases. So, and this is exactly when this thing happened on the Anand Vihar. Trust me, Govind, I was so disturbed that everybody in Delhi whom I know, I called them and I literally begged them, sir, don't let this population reach the village, because if even 1% of them are carrying the virus, we would introduce this virus in our rural sector. And if that happens, India will explode. And that's probably one of the reasons why they were stopped wherever they were. I said, no matter how much the difficulty may be, but let's not infect our rural area. And you would agree that till date, we do not have cases being reported from rural areas. Most of the cases are coming from cities. We now need to look at them very, very carefully, provide them good nutrition so that they are nutritionally well off. We also will need to address their uncertainties about the future. And that's where I think there is a huge role for religious leaders, political leaders, and social counselors to sit down and talk to them that, no, this country is together. They have a lot of uncertainty. I talk to, the people, similar people in my neighborhood, and they are, no, sir, what will happen? We are going to die. That fear is there. We need to address that fear, because a fearful body will be a weak body. So we need to address their physical status, right, mental status, and also look after their habitation so that their immunity is better and their risk of contracting this disease.
So can I ask you the same question a little more practically? So if we are saying that from May 3rd, the total, the lockdown will be lifted as things stand, and from 20th, in any case, many industries, including export zones, information technology services, will see people coming back. How do people take better care or more care, even at this point, to ensure that the spread is contained?
So two things. One is, the money away. Right now, most of them, they might be getting bread twice a day because of various NGOs, but their pockets are empty. So as Dr. Naushad very elegantly said, some money has to be reached in their pocket. Who does it? That's for people to decide, but some money has to reach them so that they have some certainty. Number one. Number two, we need to look after their nutrition aspect very well. Number three, the social distancing norms, which are so difficult to implement in their areas, but somehow NGOs or authorities will need to reach out to their areas and develop some mechanism. It may not be as effective as in your and my house, certainly not as it is in Dharavi today. So some model will need to be worked out, because this virus is here to stay for months. It's not going to go away, and it can explode again anytime. And social norms, social distancing, hand hygiene, and having face cover, these three will become the norm of our life for several months to come.
Right. So which means that while the lockdown has given us, as you said, the time to equip ourselves from an infrastructure point of view, from knowledge, understanding, and so on, in reality, the problem is nowhere near gone and will not be gone on the 3rd of May.
it's the positive thing is that it's not exploded the way it would have exploded had the lockdown not come. So that is a positive that we have. It's brought things under control. Now testing, containment of those who test positive, their isolation, contact tracing, aggressive treatment, keeping the health sector prepared. Those are the ways to finally zero in on the virus and finish the virus. In the meantime, all of us are also hoping and praying that some medicine might come up one day, or maybe by end of the year, we will have one of the vaccines coming out. Right. These two things are eagerly awaited.
Right. So there are some questions on the medicine, but I'll come to that later. Let me go to Mr. Forbes now. So SL Narasimhan and Sanjay Mittal have both asked, essentially, how much of a stimulus should we be thinking of? So should it be 10% of GDP as a financial package? Should it be more? Should it be less? And more importantly, where will this money come from? I'll first Mr. Forbes and then AKB.
Sure. I think, as a percentage of GDP, and anytime anyone ever asks me a question around numbers and percentages and the budget of the government or anything like that, if I'm in the same room as Ashok, I will leave it to him, because he has these numbers, very clearly in his head. So, my own view is that we should not chase a percentage of GDP as stimulus. We should instead look at what it is that we wish to actually achieve and go after that, and then ask the question of how we can make it as affordable as possible. So what we've recommended actually from CII, what we've recommended is that these Jan Dhan account transfers, there are about 38 million Jan Dhan accounts, 40 million Jan Dhan accounts in the country. And what we recommend is, look, don't try to target. So even if you're duplicating, it doesn't matter. The important thing is to leave no one out. And because the need is so pressing and so immediate, that arrange the direct benefit transfer right away. The total amount that we're talking of comes to around 1% of GDP. So that's the Jan Dhan account transfer. As far as the income support through enterprises in the form of loans and loan guarantees is concerned, it will actually not show as any cost to the government this year, because it will only show as a cost if the guarantees actually get invoked, if the government has to actually bear those guarantees, say a year or 2 years out. And the chances are that it will be a fairly small percentage if we can bring about a significant and widespread economic recovery. And in that time frame, we should be able to do so. So the actual costs that would be involved in actually ensuring that everyone has adequate income support is not going to be that massive.
Okay, AKB, where's the money going to come from?
Well, let me say that if you are asking for a kind of a figure that should be announced as part of a support or a stimulus measure, let me go back in time, and in 2008, the financial meltdown that happened, there was also a stimulus, and that stimulus was something like 3.3% of GDP at that time, because if you do a simple calculation of what was your fiscal deficit in 2007 and 8, which was 2.7% of GDP, that went up to 6% of GDP in the next year, 2008-9, and it stayed even higher the next year. So there was a kind of a fiscal stimulus that was given by way of reduction in taxes, allocation of more expenditure in various areas, but that was a different kind of a crisis. Now, this kind of crisis, let us not forget, the government has already announced a kind of a package of 1.7 lakh crore, which is around 0.8% of GDP. Some analysts have commented that this 1.7 lakh crore, there is a little bit of a, the same amount is being counted twice. So it may be, let us say, even if the 1 lakh crore has been announced, which is around 0.5% of GDP. Now, how much more? It's a matter of whether the government has the money or not. I don't think the government's resources are there. Government's budget is already strained. So it has to come by government going out and borrowing more from the RBI. There are some brave economists who are suggesting that let the discipline that was introduced in government's borrowing from the RBI from 1997 onwards by not allowing the government to borrow directly from the RBI, instead forcing the government to borrow it from the market and RBI being the intermediary. Now, there are some suggestions that let the RBI monetize this deficit directly by loaning the government directly. Now, I think that's a dangerous path because that will probably destroy the discipline that we have built over the last 23 years. So my sense is that government should be allowed to borrow more from the RBI, and the RBI should actually agree to that slippage. Probably this is also an opportunity, in my view, to fix some of your policy glitches. In a sense, I do feel that a good stimulus at this point in time to revive demand, apart from putting more money in the hands of the poor people, the workers and everything, would also be to reduce and rationalize your goods and services tax. Now that will mean an immediate loss of revenue, but it will achieve two purposes. One, it will fix the glitches that you have already introduced in the GST by rationalizing the rates and making them into, instead of making into maybe at best 3 rates. And second would be, in the year or 2 years later, you will see the benefit of this rationalized lower base of GST rates. So I think the government has to be bold, should not be afraid of a fiscal slippage. Money has to be found, but money should not be found through means that will question and destroy the fiscal discipline that we have already introduced by forcing government not to borrow from the market.
KB, can I put the question a little differently? I mean, for those who are, let's say, not, who don't follow economics, at least from a fiscal and monetary standpoint at a national level, do we have the money or not as a country? I mean, is there enough money to bring us out of this and to bring us onward to recovery?
Well, I don't think the universe of money is just purely defined by national boundaries. Mm-hmm. I think, you can borrow from abroad as well, provided those loans that we borrow are taken in a prudent manner with proper discipline and used judiciously. So I don't think money is an issue. Okay. It is not necessary that you have to borrow it from within the country. Already the government is going in for various, borrowing and getting listed on the global indices. So I don't think money is an issue. Government can get the money.
Right. Mr. Forbes, so here's a question from Prasad Puli, and he says, it's a statement actually, a big brother gesture from industries, and that will allow us to exploit our potential to bounce back. So could you tell us about your own organization and how are you approaching this, and would you be doing things perhaps which would help those who either work with you or are part of your sort of ecosystem downstream of vendors and OEMs and so on?
So what we're doing in our organization is, first of all, obviously we have to protect our own members. So everyone in the company, is very clear that as a company, no one needs to worry about employment. We're looking at ways in which we can have, actually as a way of building up more of a kind of pool of resources that we can draw on. We're looking at how we can have some salary cuts, especially at the top level, such that we build up a fund, but we would pay those amounts back later on when we're doing fine again. Second, we've made very sure that not only are all our own members secure, but so too all our service providers. So, whether it's a conservancy contract or a canteen contract, so the entire time that we've been closed, we've said that we will pay our canteen contractor, and then we make sure by talking to the end employees of the canteen contractor that they're also being paid by the canteen contractor. So, you try to make sure that, that your service providers are also ensuring that all of them are employed. Third, what we've tried to do with our own members is we've said that, listen, the fact that you're not using your car doesn't mean that you shouldn't be looking after the person who, let's say, washes it each day. And so, worry about, that's an example of this very kind of informal employment where you'll have people who'll come into every society and wash people's cars for them every day. They're probably not now allowed to, but they still need to live. So how do we ensure and encourage our own members to take care of the wider ecosystem that depends also on these small amounts that people can support people with? And fourth, we're trying to see what we can do from our CSR work in the community. What can we do with particular pressing needs that the community has, either on the health side, in terms of connecting them with the right kind of medical advice, or in terms of safe practices at home, or indeed in terms of actual food and support programs for them. And we've said that, listen, before we try to help someone far away, let's make sure that at least in our immediate neighborhood, in the people in the communities that are near where we are, we should ensure that they are actually taken care of.
Okay, so we've got lots of comments, and let me read off a few comments before we go on, and there are some more medical questions coming now. David Reskina, who's the Managing Director of Exim Bank, asks, just wondering if the Jandan accounts are fully accessible to the holders, not just under lockdown, but once things open. What about payments under Narega? Would you want to come in on that, Mr. Forbes?
So David probably has a better idea than I do actually on that question, but my understanding is that the Jandan accounts are accessible. That's something that the platform that has been created is pretty robust, so that even if you have a migrant worker who has a Jandan account, regardless of where it's actually registered, I believe it can be accessed anywhere in the country. So my understanding is that that's a reasonably robust system that has been put in place. I would also say that on the Jandan accounts, they're not perfect, right? There will be duplication, but I don't think we should worry too much about the duplication at this point in time. We're talking about small numbers. We're talking about 3,000 rupees or 5,000 rupees being transferred into those accounts. So what if you give someone 5,000 rupees where he's already got 5,000 rupees somewhere else? I mean, it's I think at present we should ensure coverage and not worry too much about duplication.
Right. David Reskina, again, it's a comment. Wanted to back Naushad's point about guarantees for loans. Risk aversion is very real, as bankers have had a nightmare experience with the 3 C's chasing them later on. Many of the guarantees will remain on paper, but they will make the difference in an atmosphere of risk aversion. Okay, so let's come to some of the more medical and public health questions. Dr. Kumar, so the question from Ria Forbes is, the current state of testing and your comments on that. There are no cases or few cases in rural areas. Does that reflect a lack of testing?
Yeah, that's a very good question. And this is a question which has often been asked, are we testing enough? I think the testing numbers may be low, but I want to tell something to you as a doctor. Let's take a scenario that there was a huge discrepancy between the numbers coming out of testing and the actual numbers of the ground, which means, let's say there are 1 lakh people who are infected in the country today. We know that about 85% of them will have a mild disease, but about 10 to 15% of them will have severe disease requiring hospitalization. Now, what that should reflect in is a sudden increase in the number of patients reporting to the casualties of various hospitals, government as well as private, in rural areas as well as in urban areas, number 1. And number 2, there should be a rapid increase and a serious increase in the sales of paracetamol and similar medicines in the market. Now, I have checked up with the industry people and I'm informed that there has not been any significant increase in paracetamol consumption, number 1. And by talking to dozens of my friends across the country, I have not heard from a single person that there has been a surge in the pneumonia-like illnesses without a label of COVID, known case being presenting. So there could be a small disconnect between the numbers actual and the numbers being reported, but I don't think that's a huge disconnect, number one. Number two, initially when they started, we did not have the capacity to do testing on a large rate. That also has been built, and we are now increasing every day. And now is the time when our national lockdown has restricted it to certain hotspots. This is the time to go after those hotspots in a periphery towards the center approach. Burden of that area completely disconnected from the rest of the world, and then move towards the center to contain the virus there by detecting it early. And we need more rapid tests where the results can come quickly. And then we need good isolation, contact tracing, and treatment, because ultimately it is that which will kill the virus from the community and not lockdown. Lockdown was to give us precious time to be able to have this preparedness in place.
Right. Okay. Another question, which of course keeps coming up, and to you too, I'm sure, is there any medical evidence to indicate that climactic conditions restrict the spread of this virus?
Yeah, that's a question I have answered 100 times. And whether sunlight, temperature. See, we have this virus. We have known about this virus only for the last 4 months. This virus knows us very well, but we know very little about this virus. It's a very dynamic situation every day. You know, a month back, I was on all TV channels saying that general public does not need the mask. And today I go on every channel telling that no, nobody should come out of the house without a mask. So many things are changing. As per the currently available evidence, there is nothing to suggest that the temperatures that we have in our country are going to kill the virus. If that was so, we would not have seen a surge of disease in Tamil Nadu.
Okay. Economy questions. James Abraham asks, if the government is unable to provide the necessary stimulus to protect incomes of the poor, how many lives could be lost? And that is, how many lives would be lost by a part of our population falling below the poverty line? AKB, do you want to take that?
Well, you know, it's difficult to guess, but I think, you know, we are constrained by data here. I think any post-pandemic or when the pandemic is running, you do see a rise in what are called, you know, comorbidities, other diseases, malnutrition-led diseases, and therefore death. I will not try to be alarmist here, but I will just quote you the National Health Service NHS data, which the UK government has released for the week ended April 3. And there says that data says that in the UK, for the week ended April 3, the death number has gone up to 16,000 compared to a similar period with a similar thing of 10,000. And so the incremental 6,000, out of which is only 3,400 is due to COVID. So they are worried that why is it that the non-COVID death rate has gone up? So if, I mean, you know, these are very difficult, you know, times, and you cannot draw conclusions from this data.
Right. Okay.
But I think there will be cases and we need to monitor them very closely. And an associated problem which you might be aware of, and Dr. Kumar will be, that what has happened to our entire last 4 weeks of vaccination programs. You know, if we lose a cycle of a vaccination program, do we have any risks that we are creating for the generation of people who may not have been vaccinated at this time? So I don't know. These are very difficult questions, but I don't think we can have an easy answer.
Yeah, go ahead, Dr. Kumar, on vaccination.
Yeah, so these are what are called collateral deaths, you know, because a lot of people are asking about this, that all New York hospitals presently are filled with COVID patients. So what's happening to non-COVID patients who used to be, you know, in Gangaram, we have a 40-bed ICU, which is always full. But tomorrow, if that 40-bed ICU was to have only COVID patients, what would happen to those who would have otherwise occupied this ICU? So that's a question which is there on the mind. And that's where I say resilience of your healthcare system and how much of capacity building you have done in a quick way matters. China was able to build hospitals, you know, 2,000 bed hospital in a week or 10 days. And I think we also, I'm not saying that we've done extremely well, but definitely between what we had on 20th March versus what we have today, I think there is a huge difference, not only in terms of the equipment, but happiness is more in terms of the preparedness of the manpower. When I talk to my residents, when I talk to my colleagues, we are all better aware about what to do, how to protect ourselves, all those issues. So collateral damage is a very important issue and which needs to be addressed. Otherwise, some people fear that this actually could be a bigger number. But there is a collateral benefit also. You know, we lose about 500 to 600 people on our roads every day because of road accidents. And last 3 weeks, that number is almost down to negligible.
Right.
So that's a collateral benefit also.
Great. Sameer Walia asks, let me throw this to Mr. Forbes. Is this an opportune time to raise minimum wages substantially as a means of providing an income that is not just at subsistence level, but more equitable?
So, you know, there's another question in the list where the person says, is this the right time to actually freeze minimum wages? So, you know, there were two questions on minimum wages going in different directions.
Yeah.
My own view would be that this is the wrong time to raise minimum wages. This is the time that we should ensure that whatever extra amount that we can provide, we provide to more people. So we should go for spread rather than increasing wages in themselves. Yeah. So I think at present, that should be the goal. That the goal should be not increasing wages, but preserving jobs. What we've seen happen in many areas in labor-intensive sectors is that when minimum wages have gone up, this is independent of COVID, when minimum wages have gone up, employment has sometimes been lost in those sectors as people do away with particular more marginal occupations. That's the last thing we need today.
Okay, the comment here, Sujit Samadar says, finding the money is not tough with both center and state resources at the beginning of the current financial year at about 70 lakh crores. Finding 6 to 7 lakh crore through reappropriation is not tough. Take away all capex for space, atomic energy, railways, defense, mining, etc., plus CSS schemes. Is that feasible, AKB?
No, I don't think it is feasible. I think you know, you will be creating a bigger problem. I think what is feasible is a portion of your revenue expenditure probably can be reprioritized. So that can be done. And I'm of the view that if, you know, across the various sectors of the Indian economy, there is wage cuts are happening. And depending on the level of work that you do, if you are the senior guy, depending on that, people are accepting wage cuts of a moderate 10 to 30, 15, 20%. My sense is this, that it's time to has come where the state governments and the central government should actually explore the idea of a kind of either a wage freeze or even a minor 10% wage cut. My calculation tells me a 10% wage cut for state governments and the central government will give an extra leeway of around 1.5 lakh crore. So which is almost around 0.7% of GDP. So that itself will save you something. And it will also mean that more people are participating in it. And in my view, the government employees in any case are getting more than the market wages, especially, you know, the second cadre, the third cadre tier people. So I think the government can explore the concept of either a wage freeze or a minor wage cut to get that extra money. So I think money is possible from saving from 70 lakh crore of budget money for state and the center, but we should not cut capex and we should maybe reprioritize revenue expenditure.
Okay, some health medicine questions again. Ravi Bhutalingam asks, should we not use antibody testing so that key sector workers can return to work without increasing disease risk? An add-on question, if till we get a vaccine, we obviously don't know how things are going to pan out. How will our lives be? And you know, working in an office, traveling by car, aircraft, public transport, when will all this come back to normal, if at all it does, or when it does, Dr. Kumar?
excellent and a very, very practical question. In fact, I have myself been trying to find answers for myself, but still I'll try and answer this question. First thing about the antibody testing, I think when I was mentioning about the rapid test, this is exactly what I meant. So antibody testing, this is at the point of care test where instead of waiting for a day or two with the RT-PCR, which is the case presently, this test, like a pregnancy test, it gives you report on the spot in about 15-20 minutes time. The only caveat here is that this is a test which does not detect the virus in your body. It detects your body's response to the presence of virus in the body, and it takes about a week or 10 days for that response to come. So if you are in that initial asymptomatic phase where the virus is growing in your body, but your body has not yet mounted an immune response and therefore there are no antibodies, you will be antibody negative, but infectious and antigen positive. So RT-PCR will show you as positive, but an antibody test will be a falsely negative. So that's a caveat there. So when you have a high risk, so it's good for mass screening of people where you can go for a large number. For example, Ramganj area in Jaipur, you go and do everybody's testing. And in fact, England had suggested that you can go give a COVID passport. Somebody who's antibody positive means he's already had the infection, he's mounted a response, he's unlikely to get the disease again. So he can be given a COVID passport. So do the testing, and when there are high risk category people where this is more important, if the antibody test is negative, then you follow it up with RT-PCR to really know whether the person is positive or not. Can I take?
Okay. Yeah.
When we are thinking of moving ahead from here, there is one very important message which has come out, is the correlation between air pollution, the effects of air pollution on the environment, on the human beings, and our susceptibility to get COVID and our mortality related to COVID. So there is now very strong data from North Italy, which has said that areas which had very high levels of pollution had spread of the disease much faster than those areas which are less polluted and had a much higher mortality. And similar paper has come from Harvard, where they have shown that for every 1 microgram per meter cube increase in PM 2.5, the mortality was increasing by about 15%. So these are two very important messages, that air pollution is a very important contributor. And as our world leaders think of coming out of it and pumping billions of dollars, I think this is the time, and I would take this opportunity to appeal to all of you industry leaders. You are the people who shape the destiny of our country, to fast forward at this point to a transition to a clean energy economy. You know, this is our golden chance to fast forward to a clean energy economy. We all are enjoying pristine, clean air, in our areas, but the day lockdown is lifted, this will disappear. Let's make efforts collectively today that we get that pristine air back. This will reduce our susceptibility to such episodes in future, decrease the chances of such episodes happening in future, and decrease our mortality. It's a very, very important piece of information.
Okay, Mr. Forbes, do you want to respond to that?
So, sorry, the mic's on. Okay, so I agree. What we should think about what one would need to do to be able to ensure that as activity comes back, pollution levels stay down. And I'm not sure in the short run that there is that much that one can do beyond less economic activity. In the longer run, there are lots of things that we can do. In terms of emission standards, pushing harder emission standards. We have a new emission standard that came into effect on the 1st of April. Ensuring that old vehicles also start meeting those newer emission standards through a progressive program of replacement of those vehicles. These are all things that we should be driving in a much more aggressive way. Govind, there's one question in the long list for you. And on fake news.
Yeah.
And you really should answer it, because you have set up 2 wonderful platforms with India Spend and Boom, for which, by the way, Govind won't say this, but for which he got the highest award that the Aspen organization gives anyone worldwide, the McNulty Prize. You should talk about those two. It's a real service to the country, and you should talk about them.
Yeah, I'll only for 30 seconds.
Sure.
I'm asking questions today.
Sure.
Yeah, so I think the World Health Organization has said it. I mean, this is a pandemic and an infodemic. So the challenge of countering the misinformation around this pandemic is as much as fighting the problem or the challenge medically and from a public health perspective. And therefore, it's important that all of us improve our critical thinking, because this problem can only be fixed on the demand side. On the supply side, there will always be huge amounts of information flowing. So how do I, as an individual, be more careful about the information that I get, the posts that I get on WhatsApp or on social media? And I question everything, I'm wary about everything, and I'm even suspicious about things that are forwarded, which suggest overnight cures, ranging from age-old health systems to maybe modern medicine, till we are absolutely sure that a cure has been found or will be found. So I think it's really about critical thinking and being extremely wary about what we consume and how we consume. I think that's all I would like to say. And let me now throw a question back at you.
Okay.
So Ambassador Vishnu Prakash asked, Dr. Naushad, liked your comment about the new and old normal. After all, the lesson of history is that nobody learns any lesson. And nevertheless, would Chinese credibility be impacted? And if so, in what ways?
So, so two responses to that very nice question. I think we were chatting just before the show started, and Govind, you asked us a question about will we reach a new normal? And I said that my great fear was that as the severity of this crisis, however severe it is, as the severity ebbs, and as we get back to an old lifestyle, it will be an old lifestyle. In other words, the old normal will become again the new normal, regardless of what we say now. We will fall back into old patterns and ways of working, of behaving with each other, and so on, which will be a pity. Because there are so many good lessons that we can learn from this, that we can take forward, whether it's something as efficient as working from home, or it's something as potentially transformative as a cleaner environment and the air and the quality of air that we breathe. Where I think there will be an impact is exactly where Ambassador Prakash asked the question in terms of the move away from China. I think many countries have been quite shaken by how vulnerable they found themselves to be. The US, for example, discovered that 97% of its active pharmaceutical ingredients came from China. So they suddenly discovered that they were hugely reliant on a country that they are officially in economic conflict with. And there's a shift away from that kind of vulnerability. When we've been struggling to get PPEs in place, ventilators in place, masks in place, the source is China, right? As we put in our own manufacturing capacity in all of these areas, it reduces our vulnerability and hopefully also creates a base for ongoing manufacturing activity where we can serve our own needs and we can also serve the world's needs. So I think there's a huge opportunity on its way. We need to be equipped to take advantage of it. And we need to be an outward-looking country that sees the world as our market. If we see the world as our market, we should invite the world to be in India, and we should want to be everywhere else too. That should become, in a way, the new normal for the way in which Indian corporates do business.
Right. So we've run out of time almost. So I'm going to just throw one quick question to all of you, and let me begin with Dr. Kumar. So the question is that if there is one thing, bearing in mind that we are likely to return to old ways of doing things, but if there's one way or one thing that you would change, either yourself or your organization on the 3rd of May or a little after that, what would that be? Dr. Kumar, first.
One major thing that I would change is the way we play with the environment and with our planet Earth. Unless we make a radical change in our approach towards the planet, and we make it a point that the planet's health is the guarantee for our health, and we cannot have our good health by destroying planet's health. If that understanding does not come, I can tell you these kind of pandemics will recur with increasing frequency and severity.
Okay, AKB?
Well, my thing would be that the importance of large offices, large workplaces, in a large number of service sector companies particularly, including the media in my view, is something that should come up for review. Because this crisis has told us that you can continue to do your business in many ways without necessarily having the hard physical infrastructure of the kind that you were having earlier. So I think that's a big lesson, and that probably would be experimented with, because there are cost implications, cost benefits, and one has to assess to what extent there are downsides, what are the upsides. I think that is an area where definitely the service sector will experiment with more and more. Technology companies will experiment with it more. So work from home will become part and parcel of any work schedule going forward, in my view.
Right, and I was, in a similar conversation with the cyber head of TCS yesterday, and they were saying that they moved 100,000 people into homes, or rather, I mean, they didn't move, but people started working from homes. And usually their contingency has always been about moving from one site to another site.
Right.
You know, there is some natural disaster and you move from one side to the other side. In this case, it's really people moving to homes, and 100,000 people, at least in TCS, and therefore it must be large numbers elsewhere, also working remotely, and therefore causing the relook, exactly as you said, AKB. And Mr. Forbes, last word to you.
Well, at the risk of sounding somewhat grand, we've always been told that we live in this very interconnected world. The virus and the spread of the virus worldwide proves it. It proves that we really are an interconnected world in ways that perhaps we didn't want. But I think we should also learn from that interconnectedness in a positive way and say that, look, if we can be interconnected in these areas that make us vulnerable, we've reacted to the virus by trying to become as insular as we can, closing our borders as a country, closing our cities to movement of people across the country, closing our own homes so that we become as safe and protected as we can be. And these are all natural instincts. But I think as the effect of the virus ebbs, we need to reverse that direction again and start looking out and start saying that, how do we ensure that if we have someone working in our homes who lives in circumstances that are not healthy, how do we ensure that we do something about that? Because that interconnectedness will come back and haunt us otherwise someday. If we have people who are less fortunate than we are in other cities, how do we help them? And then the same, how do we see the world as our market, but also how do we see us as being all part of the same long-term project of building healthy lifestyles across the world?
Govind, can I just add a quick
Please, please, yes.
The new world order 6 months from now will also depend on the discoveries that will happen in the medical world. Take a scenario that 6 months down the line we get a very, very effective vaccine or some very new medicine which gives a total control over this virus, and we are able to eradicate the virus. Then I guess by January of 21 we will be back to old world order. On the other hand, if the medical technology field fails to win over the virus, and this virus continues to lurk across the world will continue to work from home.
Right. Okay. Thank you very much, Dr. Kumar, and thank you all our panelists as well as all our attendees for joining in. This is an unprecedented time, and it brings together people from very varying disciplines. As you've seen, the blend of the public health, medicine, and economy is something that's very unusual, but very likely will become a usual and a new normal way of approaching fundamental challenges as we are. So thank you all for joining me. One of the points you made, Mr. Forbes, was about how life can be in future. And let me close with a wonderful line that Navita Mahajan has left. She asks, how can circles of kindness be created? And I think amongst all of other things, kindness and compassion will be a very, very critical factor in the way we are able to solve this problem and create more equality and equal opportunities for everyone in our country. Thank you very much for joining us, and see you soon.
Bye.